Welcome, everybody. Today we have an amazing special leader to leader moment. We're inviting a great friend, an amazing doctor, Dr. Ravi Kavasery.
Thank you for having me.
Welcome so much. For full disclosure, I love him. He's awesome, and we work together. And one of the highlights of this program is right now, especially that we are entering the third peak of a lot of COVID-19. The way that we are approaching quality and care and everything else has changed. And it's going to be part of the conversation that we're going to be having today. But first, Dr. Kavasery, how you ended up here in LA?
Yeah, for sure. Well, let me open with my disclosures, which are the same as yours, which is that I love working with you. You're an amazing guy, and thanks for this opportunity. How did I end up in LA? I ended up for family reasons. My wife's family is here. They're all here in Los Angeles, and we've got two little boys, and the chance to raise our kids around family and extended family and warm weather and a big diverse city. It's not a hard choice.
I hear you. I had the pleasure to work in Chicago, and it was beautiful and snowy, and it was beautiful for 3 years. That was amazing. And LA has a little bit more of absolutely everything, and at least SoCal. Tell me something. How you have an amazing. I saw a little bit of engineering. I actually started poking internet there on things that you have been hiding from us. Tell us about your educational offspring and all that stuff.
Yeah,
you ended up liking numbers and everything that you're liking.
Yeah, happy to. And I'll share this. I lived in cold weather before here too. I was in the Northeast in Boston for 10 years, and I'll tell you another thing that it's been lovely to move to LA. But the other thing that has been really nice moving here, as you know, especially in the communities that we work in, is also that the food scene is incredible, right? I mean, it's just. There's nothing like the food in LA. So it has been awesome. I'll tell you a little bit about myself. So it looks like you found when I graduated high school and I was looking to go to college, my sister and I both graduated the same year. And so, money is tight when you look for colleges and you're sending both your kids to college. I had a university that offered me a scholarship, and the requirement was that I had to study engineering. And so if I studied engineering, I got an engineering scholarship. So I studied engineering. I studied electrical engineering. I've never used those. I've never practiced a day as an electrical engineer. I've never worked a day. Nobody in their right mind would hire me as an electrical engineer. But it probably did teach me some of these key skills, right, around critical thinking, frameworks. I think. Yeah, I think that's probably right. And I wouldn't trade that for anything. But I spent almost all of my time, when I was in college, probably doing the bare minimum to get an electrical engineering degree. And then everything else was spent taking as many political science courses as I could, sociology classes, working out in the community, just trying to make people have new experiences, what everybody does in college. So, yeah.
And that's awesome. And I know that, part of your, usually, we work in a fair qualified health center. We cater to 100,000 patients, underserved community. Historically, fair qualified health centers have not been the hub of innovation or the hub of transformation. But since you came in, the quality aspect of it and the way that we are approaching things on the leadership area has changed a lot.
Yeah.
And you're bringing, we never had, we knew that population health was good to have, and we're trying to approach it, but you're actually the first one in 52 years that it's coming in and shaking a little bit everything and trying to portray that. How different is from other places to establish a new population health department?
No, thanks, Elon. This is a good question. I'll share this. I think AltaMed has all the ingredients, right? It's and so for your viewers who are learning a little bit about AltaMed who don't know, AltaMed was started 50 years ago during the Chicano Civil Rights Movement. 1969, it started out of a storefront, really born out of an idea that at that time Healthcare was not a human right in East Los Angeles. Services were not available at that time. And there were folks fighting basically to prove that this was access to a fundamental human right. And, as we think about what has grown since then in 50 years, things have changed so much in the state of California. And, in the United States, there are still some places that continue to, I think, ask these open questions. But California is not that, right? California has really embraced the idea that healthcare is a fundamental human right. People need healthcare. They need access to healthcare. And here in AltaMed, we have now, grown to this level of just taking care of such a large community of folks in the same communities where we started. And so 85% of the folks that work for AltaMed come from the same communities where we are. The organization really understands the power of civic engagement, community participation, the work that you do and that you lead for us around health education, also promotion and advocacy. All those ingredients are there. I think the one thing that has maybe changed for a lot of us is just kind of understanding federally qualified health centers have always played this extraordinary role in the U.S. healthcare system in terms of addressing for socially and medically complex populations, areas where ordinarily health systems wouldn't set up. And the reason for that is, as you know, they weren't financed that way, which is, really probably one of the crappiest reasons to not set up care, because people who go into medicine and practice medicine go in precisely for this, to help folks who need care the most. And so for AltaMed right now, I think the idea is more so understanding we have all of these ingredients, and really our mission is not to see as many patients as we can. Our mission is not to just provide episodic reactive care. Our mission is actually improve the lives of the patients that we take care of. And the only way we'll do that is if we take complete responsibility for every single person who comes in to see us. And really, even the ones who don't. The ones who don't come in to see us are the ones we worry about the most. And that kind of changes how we think a little bit about our care delivery, our infrastructure, our systems. But this is an easy one for us. Every single person who we work with, I think, comes here for the mission and really understands what we're trying to do. So it's been super fun. And I've been really, I think about this as just feeling really honored and privileged to have an opportunity to serve folks like yourself and others over here in this organization.
Dr. Kavasery, right now that there's a lot of things changing, right? We have, everybody's talking about the old, the new reality, the old reality, the new life. But first of all, you as a leader, with all the changes, what are you changing right now? Not what you have, what do you actually have learned from the transformation from pre-COVID days to COVID days?
Yeah, sure.
Where are you at with it?
I'll share a couple things here. Like right now, a lot of the buzz is these words like the new normal, or this idea, you hear a lot about people talking about, telehealth and, really what we're talking about is, broadening that aperture well beyond just, whether you go to the doctor, whether you see the doctor on a video. It's more so the idea that there has to be more to provide care, to get care closer to where people live, bringing care out into the community, bringing care to people's homes, really understanding where they live. And much of what drives healthcare is really, much of what drives health is not healthcare. So, when we think about the new normal, when we think about the things that people have been talking about in the space, I think about it from the lens of equity, right? So even prior to COVID, the idea of telehealth has for a long time made sense for the communities that we serve. The folks that we take care of, who you see in the Boyle Heights Clinic, who I see in the Southgate Clinic, they have to take time off from work in order to come in for a doctor's visit. They often have to take off half a day to come in. They have to take public transportation to come in. There's a lot of barriers to health and a lot of reasons for them to delay their health. And so now, when we think about the new normal, for me, I think about this as, the same way that I think a lot of us say, what's the opportunity here? How do we come out of this better than how we went into it? And COVID has really laid bare, I think, for us, just how many deficiencies there are in the way we think about health, how we think about equity, how we think about giving people a fair shot at their best opportunity at health. And it gives us an opportunity to amend that. It gives us a chance to do that by building a better care delivery system, by bringing care to patients, by putting tools in their hands. You've heard me say this to you before. I have, in 10 plus years of practicing medicine, I have never heard a patient say, I want my A1C less than 7, my blood pressure less than 140/90. But doctors and health systems, we talk about this stuff all the time. What I do hear people say all the time is, this is what makes my life worth living. This is who supports me today. This is who I reach out to. Here are my caregivers. If life was shorter than what I would have hoped, here's what becomes exceedingly important in these moments. And I think for us, it gives us an opportunity to I think really in these moments, think about if we want to give everybody a fair shot at their health, what actually achieves health, what actually brings value, and how do we get rid of the rest of that stuff? And that's the moment I think we're in right now. I hope we take advantage of it in the right way and see this as a leapfrog moment, right? It cannot be incrementalism. It cannot be just reconceptualizing face-to-face visits as virtual visits. That is not what this moment is about. This moment is, how do we improve the lives of patients? How do we take some of these huge structural deficiencies and racism, barriers that have existed for a long time, for far too long in healthcare, and use this as a rallying cry to say, look, never again are we gonna, we're gonna move forward in this moment, and we're not gonna allow that to take place again.
I completely love the part of, the point is not technology. The point is actually going back to, human design. And I love how you put it, that we need to go back to the patient and figure out what we're actually learning, and put it out there. And I have shared this in a lot of forums. And one of the things that I actually am loving from COVID-19, and I'm using the word love, is that I would still remember when my pediatrician used to come to my house,
right,
to take care of me,
right,
when I was a tiny boy.
Yeah.
Then and he came with his thing, and he did the stethoscope thing. I do not remember. Everybody asked me if he brought shots. I do not remember he brought shots, but for sure he probably gave me penicillin every day.
Right. But he came to your home. He saw you where you lived, and yeah, absolutely.
And for the first time in the US, I'm having the option, to actually go inside of a kid that has neurological issues, that usually when they are not comfortable in my office, and they are comfortable at their homes, and I'm seeing them socializing in a different way and in a different rhythm, and that's thanks to that bridge that we're creating right now with things that we have, the tools that we have. And I'm loving that part, because I'm having I'm seeing grandma passing through the backyard. And
Ilana, what you share here, I think, is just such a big, the value of doing that is so important. But yeah, if I'm a patient, I'm receiving that kind of care. I remember when I was I think it was in medical school training, I spent time in school-based clinics, right? And then I would see these same teenagers who would be seen in a school-based clinic, then have to come into the clinic, like the actual physical clinic. And they behave so differently. When they saw me in a school-based clinic, I was seeing them in their house, if you will, right? In their environment, where they were more likely to be able to be their authentic self. And when they came into the clinic, it was much more, at this sort of 15-minute visit, everything was sort of closed off, and it was just a very different environment. And so, but I think there are these lessons around this. You know what good looks like when you see it. And I think for us, this moment for us is entirely that, right? We've got to bring health far outside of the clinic, brick and mortar setting, out to patients. And it's not about just technology. Technology is a vehicle, but there's a lot of other ways to do it. And not everybody wants technology. Some folks want, that house call. Some folks want, and I think we've got to really sort of right size this stuff for every patient. And the only way we'll get there is understanding what makes life worth living for every single person we take care of.
I completely agree. And I love how you're saying, because we're breaking a lot of things that we thought they were the rules of the land. And one of them was that underserved populations do not have access to technology, or don't have access to a cell phone, or don't. In reality, that we were asking the wrong question is, what if they use a cell phone or internet? Why are they using it for?
Right.
Then at least right now, what we are seeing is that the tools were there. The thing is, it was like for streaming, it was for emails, it was for texting, but not for healthcare.
Right.
Then when you add the healthcare part, and you're like, oh, by the way, you can actually see your medical stuff. Like, what? You can actually do your you can use my AltaMed chart to actually talk to your doctor. Like,
right.
Can I do that?
Right.
That's when actually everything starts like open.
I think that's totally right. I think there's a lot that can be done, and this, and I think this is what you're highlighting is, and for your viewers too, right? Is that I think some of the things that we learned after the passage of the Affordable Care Act, AltaMed did a ton of community level groundwork and really understood our patients and their needs. But one of the things that we learned during that exercise was this idea that technology, particularly cell phone technology, that digital divide was not nearly as large as it was prior to 2010, 2009. It turned out, even for many of our patients who again are essential workers, are working poor, face significant challenges in terms of social determinants of health, but they had cell phones. And to your point, the question is, what do they use those cell phones for? And how do we make sure that we also can take those cell phones and however it is that they communicate, or what makes it easy for them to do things for their health, and actually partner with them. And so this is an awesome opportunity to do that. I know you're super thoughtful about this stuff, and we've had a chance to kind of think about this out loud a little bit too.
Yeah, no, and that's the exciting part. That I'm saying, in the old days was like there's a price for technology. There's and you were talking about population health. We have 300,000 patients. It's not a small number. We're talking about technology. The equipment was very high, but right now, like telehealth kits where you have a stethoscope, a weight scale, and other stuff. Right now, it's accessible. It's something that before it's like it was a dream. It was not even a conversation. It was like, that's nice.
Right.
Yeah, maybe somewhere else they will. Yes, but right now it's something real, and and probably you have the same feeling that we jumped our telehealth plan that was probably going to take a couple of years to fully develop and mature and have policies in place from the state level to the local level. Right. That happened in 2 weeks.
It's like we didn't build Rome in a day, but I feel like we built AltaMed in 5, right? It's kind of like we did years worth of work in weeks to months, and really, and a lot of healthcare did this too, a lot of our partners. But you're absolutely right. I've also been, to that point, I have been really amazed, and my thinking has changed and evolved on what telehealth can do. I think I sort of had an idea in my mind of what telehealth is. And I think this is also tricky in that we've used this as a very monolithic term, the word telehealth, right? But telehealth, underneath it, all of the different aspects of it, you can actually do a tremendous amount with telehealth. I have learned a lot over the past several months as we've looked at different groups and looked at different technologies and capabilities. I'll highlight a couple things that I think remain problems to solve. So that if you've got viewers out there who really care about this and are looking for important problems to solve, things that you and I see, right? So one of them, I think, is language and cultural concordance. I think still today, telehealth, there are significant language and cultural barriers around providing care. And I think language-centric care becomes incredibly important, particularly as we move to where it's not just telehealth, but technologies that really are about putting the patient front and center. It's important, if we're going to put a patient inside the value chain of their care and really in the driver's seat of their care, that we do it and really, speak to them in their languages, where messaging is culturally appropriate. I think we did a lot of that work really well when we did our COVID testing and a lot of that work earlier this year. So I'd say that, and if you've got people out there who are excited about that, that is somewhere where we need a ton of energy and creativity.
No, and Dr. Kavasery, that's kind of where we are right now, right? We never thought that we're going to have a teledentistry. A part of everything that we're asking and doing is teledentistry, telemental health. Actually, usually, you need to have wait on the clinic, stay, whatever. And right now, the community actually needs it because, we're both practicing on the community. And sometimes we hear like, doc, I'm sorry, I'm not going.
Right.
I actually need to work because if I don't work, there's no food on the table.
Right.
Right now, they can do the entire visit in their lunch break.
Right.
And have, appropriate care.
Right.
If they need to escalate, they can go to us or our urgent care. It changes the dynamic. Yeah. What you were saying is completely correct. As population health we're meeting the patient where it's comfortable for them and not where it's comfortable for me.
Right. We're not organizing it around your workday or my workday. I think that's right. I'll make another point about dentistry that I think is interesting. I remember years ago when I lived in Baltimore, there were some studies that were done that were very informative for me, which is for a long time, we've always talked about healthcare. And I think folks in their mind, when they're talking about health, go to medical care, right? And they think about dental care as separate. But I remember, some of the work that had been done in Baltimore City was, asking folks who at that time did not have, this is all before the Affordable Care Act and before the expansion of Medicaid, to really ask folks, if you needed access to care, what is most important for you right now? And many individuals, not surprisingly, actually chose dental care even at a higher priority than medical care. And for some of the reasons I think that you described, one, dental pain is exceedingly difficult pain, right, to go through if you have bad dental pain. But the second piece, which you highlighted, is that people have to work. And it turns out that, the first thing that often folks see when you go to work, right, or folks have to feel confident, and they have to have a level of confidence around how they look and how they smile. And, some of these things I think we've sort of separated out. And so again, I know we talked about, telehealth here, and we sort of moved a little bit to dentistry, but I just want to call out that point here, right, which is, that dental health component also, like what matters to folks and what's necessary. I think these things are tremendously important when we think about people holistically.
Yeah, completely. And then the following things that we have, we saw the clinics at the beginning, and that's actually one of the things that I love from the things that you do, is that you don't see, a problem. You don't see diabetes. You see, diabetes plus what can we do in the community, plus, what's the policy with this, but, it comes around with a lot of things because, as we know, and this actually was a secret for me, hidden for many years, that I thought that me as a doctor, I had all the mighty power to change the life of absolutely everybody that came to my to my clinic. And oh boy, it was in a huge error. On reality, me as a doctor, as a healthcare system, we have 15% or 20% of their health control in our hands. The 80% or 85%, it's outside of the door.
That's right.
It's the water, it's the stress, it's actually where they study, what they eat, all the stuff that I have cinch control.
Right. I'll share a couple things that you brought up there that I think are also interesting. That patients come to the doctor for the doctor, but they often stay for different reasons. And you, and your viewers must know, you oversee a team of promotoras, right? Of really folks who are really committed to accompanying patients and helping them build their own level of confidence around managing their own health. And I think to that point, what you've also highlighted there is really, and I'll give an example from my old workplace where I used to work. We had a very active, however you want to call it, promotora, community health worker, accompagnateur, a health coach, but we had a very active program in my old job. And one of the things that was really one of the stories that stuck with me was a patient who did not have the confidence to come to the clinic. She was socially isolated. She didn't have the confidence. And so her health coach said, you know what? I'm going to come meet you at your house today and we'll ride the bus together. I'll show you how to ride the buses in Seattle. I'll show you how to take the bus, how to transfer at this stop, and then make it to the clinic. And then that night she rode back with the patient after her appointment. And she said, the next time you come on your own. And the patient did. And the coach was waiting there for her when she showed up at the appointment. But it's that level of building a level of trust and confidence that will start to partner and start to build and drive health. So I think these things are really, it's very cool to me that, the concepts that you and I are thinking about now are things that are well known to folks. And I think what we're trying to figure out is, how do you scale this stuff? How do you make it easy to do the right thing? So these stories that we're telling each other are not the exception of this one story we reach for, but instead are actually the rule. Like every single time we say, that's actually the quality of care that we delivered.
I completely agree. And this is kind of the stuff that we do, the importance of group visits, the importance of actually having certain conversations on a group scale and making sure that we are there for absolutely everybody. Those are the things that we can actually entrust and create a conversation with everybody. We're talking about, we use a model, impact model. And right now, a lot of the things that we did were helping out with simple stuff. We had a patient that struggled a lot with COVID-19. The entire family was sick and they couldn't go out. And, part of the, the promotor, the coach, actually went, the community health specialist, they went, and brought safely. They went to the food pantry. They brought food, and that way, at least, there's that continuation, because that's health, that's wellness. It's not, we all know that diabetes is horrible. We all know that hypertension is horrible. But do we have? Am I depressed? Am I having issues? Am I running all day long with my 3 or 4 jobs to make sure that my kids actually eat? Then those are the things that as healthcare we need to start seeing. And and don't tell any doctor, but in reality, like I think that more coaches in touch with a very well defined team with doctors, nurses, nurse practitioners, PAs, psychologists, nutritionists. That's the way and the best approach that we're trying to achieve for our community, because the things that you need or I need are different. And the way that I want someone to talk to me, like my wife knows. If
Right.
something needs to know, she knows. She knows which key
That's
she needs to.
that's because she's your wife, but she's also your coach. Yeah.
Yeah, no, she
Right.
knows which one
That's right.
buttons,
That's right.
keys.
Mine
Yeah, she
too.
knows.
Right.
And that's kind of the thing that we need right now to
Right.
figure out that type of companionship. And my dream would be to actually have a promotora for my team, or a diabetes prevention program, and touch anybody that comes in and have it already part of it. And that you're going to talk to Maria, to Juanita, to Jones, to
Yes.
like to
Correct.
George,
Yeah.
whatever.
Right.
That you have them in front of you to help you with your entire process.
Totally. I think that's really well said. I couldn't agree more.
Right now, we're approaching the last couple of minutes. I really want to know what are your feelings and thoughts for Dr. Kavasery in 3 years? What do you think that you're going to be telling your teams, your leaders in the community, of the things that you learned in COVID times?
Yeah, I think this is a chance for us. That's a good question. I haven't really thought too much about. We've been so, I think, so programmed to kind of just think about even sort of just a crisis mindset of really week to week, month to month, quarter to quarter, that we haven't done that long range thinking that you're right that we should do. I think if we step out, 3 years from now, some of the things that I hope will be the case are things where we understand, one, that we no longer reimburse medical care based off of a transactional episodic care. Only if we're actually improving the lives of the patients who we take care of, are we financially reimbursed for that. I hope we clean up the financial model of reimbursement in the United States around healthcare. I think it might take longer than 3 years, but I think that's the first problem to solve. I think also things for me that have really come to light during this time that we still have not really registered the population health toll on, but certainly understand it, is mental health, is social isolation, is depression, is anxiety, is folks feeling robbed of, a future, whether that be an economic future or a professional future, because they've been at launching points in their life or getting ready or working hard for the next step and have not been able to financially prepare for it because of the tremendous economic fallout of COVID-19. And I think for me, a lot of where we will be spending our time and reflecting on that is saying, did we in this moment prepare enough for those issues? I think we're seeing that playing out on the national stage today, which is that for you and I think, we're holistic thinkers around this, right? And we can sort of see where people sit on every side of this. What's so interesting is that the politics of this have become so divisive that folks have really separated financial security from public health, when you and I both know these things couldn't be more intertwined, and we need to be thinking about these in the same way, which is that you cannot have financial security without ensuring public health. And so I think a lot of what we're going to be doing is looking at this time and saying, what were the decisions that we needed to make as leaders? Did we step up in these moments? This is hopefully a once in a lifetime event that we're going through. So did we make the most of it to really take care of those who we love?
Thank you so much for your words. You have been amazing. I'm very thankful for actually having you and actually be having you as a friend, and most importantly as a great leader here in our community. We're living weird times, and the only constant is change. And I agree with you. It sometimes it's day to day, week by week, quarter by quarter. But I'm sure right now that at least right now, in the time that we are doing this recording, the third wave is coming. It's actually here.
Right.
But I think that we have learned a lot of what happened before, what we can actually change, and most importantly, what can we do as a community
Right.
make a difference. Then, Doctor, what a pleasure.
Thank you.
Everything.
You know, I love working with you so much, and you are a great friend, and I'm really just thanks for giving me an opportunity to do this. So this has been super fun, and I will see you in person very soon.
Excellent. This is actually the beginning. Right now we spread the joy.
I love it. I love it. Yes.
Don't hang up. I'm going to close it. Don't move.
Okay, sounds good. Bye, Len.
Thank you, everybody. Have a beautiful, beautiful day, night, anywhere, at any time that you're taking. If you're having insomnia, just watch the video. You promise you will actually have more because you will ask more questions. Send us questions, concerns, anything that you have. We're here to answer anything that you are having. Then it's important as leaders right now in healthcare, we continue to push forward with ethics, moral, and most importantly, to make sure that we're translating medical-ish to some language that actually our community and patients can understand to me and made proper educational engagements with the healthcare system. Then have a beautiful day, night, or whatever.